Ladies and gentlemen, it is Bertram Lancico, and thank you for attending the roundup. If you're new to this live stream, and maybe we're a new connection, I hold these roundups probably a couple times a month. And what we're trying to do is just to try to bring people together. I've realized the power of networking, the power of relationships, and I love conferences, but sometimes travel can be expensive. Sometimes it's hard to get there. Sometimes once you get there, everybody's so busy you may just catch somebody going to the bathroom that you're trying to connect with, and that's inappropriate, right? Talking to them on either side. And then you're trying your best to do whatever you can. And I remember a recent experience. A former coworker of mine, we'll just call him Scott. Scott's like, "Hey Bertram," I saw him in the restroom. He's like, "Hey Bertram, I want to talk to you. Let's talk, a little bit later." I go to the exhibit hall. Scott's gone. All the exhibitors are gone, and it's like we keep on having this disconnect. So I thought, why don't we do something where all of us can connect? We can share jobs, we can share opportunities, and let's all realize that within revenue cycle and health information management, it's a lot more than just medical coding. Yes, medical coding is a big part of it, but there's a billing side, there's a patient financial services side of it, right? There's even the intake or the registration, and the compliance and the fraud and the risk and all of you have to realize like this goes all the way up to the highest level. Revenue cycle, as has been told to me, is the second highest spend just under clinical services. So that'll be like physicians and nurses. It's the second highest spend for hospitals. I would have thought it would have been facilities. I would have thought maybe their payroll. No, it is revenue cycle and health information management. So that's how important each of our jobs are. And that's why we're here today. So thank you and welcome to the roundup. And I can't wait to get started. So as I iterated a little bit earlier, and feel free to shout out in the comments. I know we're approaching the holiday season, so we may not have as many regular attendees as we usually do, but that's absolutely fine. Also, our apologies, there's a slight delay with the technology that we're using to live stream. So LinkedIn, for somewhat odd reason, you can't live stream directly on LinkedIn, so we have to use another service. Absolutely fine and great service, goes to multiple platforms, but sometimes there's a little delay. But feel free to say, hey, shout us out and let us know where you're from, okay? Stacy, you have been a regular attendee to the roundup, so thank you. It's not snowy here in Florida. I'm in the Clearwater, Florida, Pinellas County area, just 15 or so minutes away from Tampa, depending where you're going, either direction. So we're cold, and I can tell you, we don't need snow to have Uggs here. It's like 70 degrees and all the ladies have their Uggs on, including the kids, okay? We have Betty, she is backstage, and there she goes with her y'all. I know it was gonna come, so I love Betty. She's gonna be a great subject matter expert for all of us to learn a lot from, and welcome as well. We have Jeanette, I believe we're our more recent connection. Thank you for being connected, and all the way from Washington. Wow, it's early where you are. Thank you for being here. And we have Shakira from El Paso. Wow, it's another far place from Florida. But that is the whole point, ladies and gentlemen. I want us to be able to connect as to no matter where we are, right? It can be across the country. It can be even Hawaii. I know it's going to happen one of these days. But I appreciate you for saying hi and joining the roundup. Also remember, if you can't stay for the whole duration, holiday season, we're all very busy professionally and personally. You can always come back to this recording. I also will have this on LinkedIn as well. So if you want to go, on YouTube as well. So if YouTube may work a little bit easier, I don't know, for when you're working out or in being in the background, whatever you're doing, that's also going to be there as well. We have Victoria saying, hi, we are honored with your presence. Thank you for attending. And LinkedIn user from Chicagoland. Now, there are two ways that you can watch the roundup. Well, there are a few ways, but the two most popular ways, there's one where you actually click in and you're attending live and you see the comments. You are able to watch the roundup from your LinkedIn feed, but you're not going to be fully into the roundup, if that makes sense. So we love and appreciate you for attending, but try your best to actually join and jump into the roundup, not just by watching it on your feed and it's like this small, okay? Should be a lot bigger. All right. Hold on. Well, this person, maybe one of our first Hawaii attendees informally. So they work for a client in Hawaii, but they live in Georgia. So that's just, maybe that cost of living difference is just working out a lot for you, okay? And Stacey is sharing with us that she's working on her CPMA, so she's excited to learn about more about compliance from Betty today, and that's why we're here. Okay, so we're trying to do this as many times as we can. I mean, we're having such a positive impact, even just random people that I happen to connect with, they're talking about the roundup. So I truly do not believe the numbers. I believe we have a lot more viewership than, let's say, 30 or 40, even to 100 and something people. That viewership is going out there and it's making waves because it's different. And it's also very different from coming from an executive standpoint. I know a lot of the subject matter experts we have within our field happen to be, coders, right? Managers, directors. There's really no one coming from the outside or looking from the outside in involved in the industry doing something like this. And I appreciate it. And I would love to continue doing this. And if you ever happen to need a speaker, whether that be for your chapter meeting, for a conference, we're definitely here to show a different take and speak to a younger generation and a younger audience if we can. All right. So our mission is to help 100 revenue cycle professionals get hired. We have 3 hired so far. If you didn't see the roundup last week, I think that's one of our most powerful and meaningful ones just yet. That was with Misty. Misty and I connected a few months ago. She was like many of you, just got her first CPCA. She's working, she's applying, she's getting a lot of rejection, but she's like, I have to figure this out. I have to figure this out. And then from attending the roundup and just trying her best to put herself out there, whether she would learn something or hear something, she would post it and she would share it with her network. And she had a situation of quiet hiring. This person was kind of looking at her and seeing what Missy could probably do, probably more seeing if she was a cultural fit for the opportunity, and said, hey, why don't you talk to some of our folks in HR as well as our team? We believe we may have an opportunity for you. And it's so funny, Missy shared with us, she didn't even really put a lot of heart into it. She's like, you know what, that's fine. I can talk to these individuals. That's fine. It's like the job that she was applying for, she got all nervous about, but the one that was naturally meant for her just came through, and it was just, it worked out. And now she's working, and now she's doing great. She's learning a lot, as she says. And one of the things that she shared with us last week was she critiqued her resume, that the original resume that as soon as she got credentialed and she was sending it out wasn't up to snuff. Going through the process, she realized that I can do better. I can articulate the things that these hiring managers are looking for. And where did she learn those tips and tricks? Is from the rejection. So it's either you win or you learn, and I believe either way you're winning, because you're going to be better the next time around. Okay. All right. So today we're going to learn more about compliance and audits and how the whole thing works from Betty. I'm also going to share some available job opportunities that we have, a vendor spotlight, resume hiring, ask some questions, ask the Mr. B section, candidate showcase. So if you are a candidate and if you happen to be open to new opportunities, we would love for you to share your background, your email, and what you're looking for. For example, Bertram, I'm a CPCA. This is the city and state that I am in. And what I'm going to do, I'm going to save those comments to the end of the presentation. So if there are any recruiters or hiring managers that are attending, that they can go ahead and they can share with us, or they can just reach out to you directly. Okay. We also believe it's very hard for a lot of people to showcase themselves and showcase their talents, showcase that they're available. I know that within Renown Talent and what we're doing, we're going to have a lot of opportunities in the near future. 2024 is probably going to be our best year yet, because that's what we're ramping up to. And there's going to be a lot of jobs and opportunities. But I also believe in timing and how everything can just work so perfectly. So feel free to share if you're open for opportunities and all of that good stuff. All right. We have Christine from North Carolina. Thank you so much for coming and attending. Okay. All right, so I would love to introduce our speaker today. And let me get to this. So Betty is a nationally acclaimed healthcare consultant, author, speaker, and has over 30 years of our industry and revenue cycle experience. Her passion lies in assisting practices in maintaining compliance and profitability through expert auditing. She collaborates with practices of all sizes with her, unwavering dedication to each. She's even had a chance to educate diverse healthcare professionals nationwide, covering topics from ICD-10 to CPT specialties. Betty is also great at diving into most recent guideline changes, and when the OIG releases something or has a statement. If you happen to follow her on LinkedIn, she's one of the persons that's going to actually go through that whole document and kind of translate to us within understandable English exactly what that means. So if you're not following her, definitely give her a follow. Let her know that you heard of her on the roundup, we definitely appreciate it. She also co-authored manuals on coding and auditing, whether that be through telemedicine, orthopedics, and sports medicine. She's hosting healthcare happenings, so she also has a live stream that I would definitely love for you to attend and be on there. We were on there, featured on there a few months ago as well, and she also discusses healthcare trends with the guests. She has her BS. She has a CPC, COC, CP. I mean, you can read it. The list just goes on and on and on and on. So she knows her stuff. And she's also an advisor, also, I believe, on the editorial board, as well as worked with AHEMA. So without further ado, I'll love to bring Betty to the stage. Betty, thank you so much for being here and attending the roundup. How are you doing today?
Good. Thank you, Bertram, for having me. And hey, y'all.
There it is. There it is. I'm gonna count every time you say the y'alls. Okay. And we have Victoria chiming in, just saying, "Hey, Betty, how are you doing?" Of course,
Hey,
you are amazing.
Victoria.
Yes, yes,
Yeah,
yes.
we
So,
just spent some time together at the NEMA's conference, Victoria, and I
ah,
know Sonal's on here. So a lot of us, you have to, it's one of the things, the tip from me is to make sure, you're keeping up on all this stuff. So we just had a good
exactly.
time all together in Charleston.
Yes, yes. I did see some of those pictures, and yeah, thank you for sharing. Now, let's go back
Yes.
30 or so years. How did you find yourself getting involved within revenue cycle and health information management, then on compliance to doing all the amazing things that you're doing today?
Well, actually, I started out as an x-ray tech. And I was in a hospital that was, we didn't call it the county hospital, but it was the county hospital. It was the one where we got the prisoners from the prison and, all
Okay.
that kind of, we would get them in there. And we would do, I had a couple cases back to back that just kind of took it out of me. For those people that are a little more mature, like myself, I got the pleasure of x-raying Richard Speck, and it was like the scariest, freakiest thing I ever did. And shortly after that, we had a dead person that came in through the ED, and they had put him in a side room, and we needed to x-ray his neck to see whether he had died from strangulation. He got a toe chain cable wrapped around his neck. So they needed to know whether he died of strangulation or a broken neck. So we were in there with this deceased body, and he was a big man, and he was in all the winter gear. It was in the middle of winter, and it
Mm-hmm.
took us like a long time to get this done. And so there was like 4 of us in here and it was just, I was like, okay, this is just too much. It's just it's too
Yes.
much. I don't want to do it
Now,
anymore.
is this the same Richard Speck? I just did a quick Google search that murdered 8 nurses
Yes,
in
it
one
is.
night? What?
Yes, it is. Yeah. Yeah. Talk
Something's got
about
to give.
evil personified. Is looking in that man's eyes is like black pits, and it just freaked me
Mm,
out. I couldn't sleep for quite a while after that because I'm a big
mm.
horror movie fan anyway. So, you have all that kind of stuff on top of it. So my mind just starts going. But when I quit, I said, I just, it's just not for me. It's not my thing.
Okay.
And they said, well, you have a medical background, you've been in the field, so we have a great job for you. You can pick whichever clinic you want to go to. The hospital had owned 5 clinics, and there was one that happened to be like 5 minutes from my house. And I was like, okay, I'll go to this one. So I showed up, and for 2 weeks, every day I would go to this room all by myself, and I would sit in there all by myself with a CPT and a HCPCS book and an ICD-9 book back then.
Mhm.
And I just did that for 2 weeks straight. I didn't know what I was supposed to be doing. So, I'm looking through the books, and I was like, okay. And then after the 2 weeks, they came and they said, okay, your desk is ready. So I thought, okay, they just were waiting till they had somewhere to put me. And so we get to the desk, and they said, okay, your training's over, get to work. So 2 weeks by myself, alone in a room, was
Wow.
my onboarding to the job. And of course, they didn't call people coders and things back then.
Mhm.
So I had responsibility for the physical therapy office that was across the hall from us, and for the 4 or 5 internal medicine physicians that were in the office proper.
Mhm.
And So I would just kind of go through, or kind of trying to figure out if things are right, if they're not right. I had a network of people that we would call each other on the phone, like, where did you find this? And how did you code that? And I was pretty good at CPT because I'm from X-ray. So with X-ray, everything's body part driven. And in CPT, everything can be found body part, or procedure. So it was pretty good. ICD-9, I was so terrible at, because I would look, somebody said they had chest pain. I'm looking under chest. And of course, there's nothing there. It would always say C condition. Oh, I hated that. So I was really bad at that. But back then, if we didn't figure out, like, I knew I didn't want to send, just anything out on the claim form. I'm like, that's not right. And so our claims would drop every Friday, because we didn't have electronic claims back then. In fact, we had just gotten off of having to typewrite them on a typewriter. So we had those dot matrix printers. And so all the claims would run on Friday. So I could keep something up until Thursday to try to figure out what the ICD-9 code was. And if by Thursday I couldn't figure it out, it would just drop without an ICD-9 code. And back then, we'd get paid. You didn't have to have a diagnosis code on claims, believe it or not. So it was really great back then in those kind of aspects. Like you could like not know what you were doing and still get paid for it. So then they had the law, the rules came out that no, you have to tell us why you did it. And so I just wanted to learn more and more about, I'm like, okay, if this is what I'm going to be doing, I need to know what I'm doing, but there wasn't a lot of education back then. There weren't a lot of classes. I was, somebody came to me once and had said something about, a group of us are being sent for this crash course to get certified. And I was like, I didn't even know what that was. It was in the early 80s. And so we go to take the CPC exam, and I did pass it on my first try. Was kind of amazed, but it was kind of a daunting task, and I just kept moving through. And as I moved to different positions, I would just always keep learning, keep growing. Then they started having classes. I became a CPC instructor through AAPC and got more involved in AAPC. Was on the National Advisory Board, and instructed a lot. I still get hear from former students of mine, and I just love that. In fact, we were just talking about one before we started. So I keep in touch with a lot of them. And, I just kept wanting to know more and more and more. And so I moved in. I think my best job for me, growth wise, was working for a faculty foundation. And we had 450 to 500 physicians in the faculty. Wow. And I started an E&M abstraction department while I was there, because prior to 95, we had office visits. There were no evaluation and management codes, and they were just coded by time. So it was real easy. So E&M came out, of course, with all of the, the problem focus and expanded and all that junk. So we had E&M coders then. And so I started an abstraction department where I was. And so every chart after the patient was discharged from the hospital, we would get in the department. And then you would code everything from the time the patient was admitted to the time they were discharged. And you would code it, everything, any specialty, no matter what it was. If they were a faculty member, we coded it. So I got to code for every specialty out there. And that really broadened out my perspective and what I got to see and my knowledge base. So I never got pigeonholed into just one specialty. And that, I think, was the best thing for me, especially moving into consulting and things like that. Because as I got further in my career, I kind of figured that, I'm not the best employee for somebody else, because it was like, well, we have to do it this way and you have to do this, and things that didn't quite make sense to me. I'm like, but why would you do it like that? Why wouldn't you, educate them? Or why wouldn't you do this? And it was like, well, that's the way we do it, and you have to do it like that. So I always ended up with kind of conflicts conflicting things going on because I just
Mm,
felt I had a better way to do it. And I'm pretty personable, I think,
you
so when
are.
I would talk with the physicians and with other coders, they were pretty open to how I would speak to them and how I gave them education. So, and I really, really like that part of it. The education part really drives me. I don't code per se every day anymore. If a client needs
Of
help,
course.
I'll jump in and do stuff, but
Of
it
course.
just was not the thing to sustain me forever. I wanted to move into other things. So, I got into education, got my CPCI, started my own company. So I was doing CPC classes and trainings. And then I got to start speaking back when the AAPC had workshop trainers. So we would go for the AAPC to different cities and
Hmm.
educate on different things. And so I used to do that. And just kept, if something new came out, and it flicked my interest, then I dive into that and see what that was.
There you go.
Dermatology is one of the specialties I really, really love, and I have a lot of derm clients. And it was just, I have a lot of derm conditions myself, so I think that's why I kind of was like really
Hmm.
interested in it, because I'd go to the physicians and I'd be asking them all kind of questions about my
Yes.
issues. I was a clinical trial patient for one of my doctors for
Nice.
a derm thing that was coming out, so cardiology is another specialty I really, really like. And in fact, it's funny. I said when I used to train and educate people for taking the exams, when we get to that section, by the time I was done with cardiology, I would get people coming up to me, and it was either, I really love this, this is so interesting, or they would say, I never want to see this again.
Yes.
Like done with it. So it's kind of like a love or hate it thing.
Yes.
And so, I've just kind of worked for the AAPC. I was a director for ICD-10 development and education. So for those of y'all who got trained from AAPC and one of our bajillion boot camps that we had before ICD-10 went live, I assisted in writing those manuals, and you might have been trained by me around the country in those. And then I was at Karen Zupko and Associates, another very good consulting firm that's out there. And I kind of got the bug again. The same thing started happening where I was like, well, shouldn't we try this way? And should we, to where it just is like, no, I can do it. So I was like, okay, I got to do it. So I went back out on my own again with Compliant Healthcare Solutions, my current company.
Nice.
And, with my thought on stuff is that without coding and billing, you can't get paid. We're not going to have the finances to keep the doors open. And then without auditing, we can't check to make sure that what the coding and billing is doing is correct, and the documentation, of course.
Hmm.
And then with compliance is kind of like the check for everything to make sure all of our ducks are in a row with everything we're doing. So for me, it's just been kind of like a progression through, what we're doing for everything. And I
Yes.
was on John Piaskowski started this the cheerleading, the coding cheerleader thing, and I was on
Yes.
his inaugural episode. And I kind of says, with compliance, you're kind of, in auditing, you're like the homework checker mom.
Hmm.
You get to like look up and see what's going on and help people stay compliant and profitable and cover themselves, because
Correct.
lately it's not if you get audited, it's when you get audited.
Mm,
Somebody at some point is going to ask you for records, whether it be Medicare, whether it be commercial payor, somebody's going to want to see them. And so you need to make sure that all your stuff is good and you're covered,
yeah,
because
absolutely.
with the conversion factor going down next year, and the payments as out of whack as they're getting, practices need every dollar they deserve.
Correct.
And it's a shame when I'm working with a physician now, that we're going through something with one of the payors. And I said, you work very hard for your patients, and, you need all that money. You're not trying to get more than you deserve, but you need what you deserve.
Deserve. That's right.
So that's kind of where I see where I step in is to make sure that the practices get what they deserve because they need it.
Yeah, definitely. Reimbursement from a physician office level has actually gone down to the point where even a lot of young med students will be talking to their professors and their mentors and like, what should I do? There's a gentleman that I know through our family, and he was going to be a doctor, but he got talked out of being a doctor because
Yeah.
of everything that was changing. So he went to go be a dentist. Definitely from the coding standpoint, much easier, right? But he was able to control a lot more within his office and within his revenue. I mean, for example, the coding is so easy, as I understand, within a dental office. It's like your insurance is only going to cover this, so this is what it's going to be. What are you going to do? There was no and ifs or buts about it, and usually from a reimbursement standpoint, they were fine. You know, hey, they had this done, sure, okay, cool, and it wasn't like, oh, like it didn't go through all of that process. So it's, you know,
Yeah.
it's much similar on that, much simpler on that side. Um, but that might be news to a lot of us because when we look at our bills, that as to what we're paying for insurance or towards a doctor, that price is skyrocketing,
That's sure
right?
not going down, right?
But so that's a whole nother conversation. We
I
probably
was
need to
going to
have a
say that's a
finance
whole nother
expert.
show.
Yeah, we probably need to have a finance person come and help us understand about inflation and raising pay rates and all of that stuff, what that has to do. You brought up a very good topic as to you were growing within your career and you're getting it. You're getting all of these credentials, you're getting all these certifications, you're working with all of these different boards and committees and associations. And not everywhere, but a lot of places you'll get to the top and you will be like, hey, what's going on? And then you're doing your auditing, right? And your team is working on it and you're doing the education. But then maybe it's a physician or physicians that are not doing what they're supposed to do. Maybe it's the coders and they're not doing what they are supposed to do, right? Um, how do you tackle that? Because I think we've all dealt with that or had a physician or, you know, maybe we've had physicians at a certain practice that have been doing things a certain way for so long. And we're nice, we're cordial, you know, we'll bring them in, we'll buy whatever and like, hey, come in and we're going to do this education. And they can even attend, but they don't change. What has been something or a strategy that anyone can use, even for, let's say, I'm a little biller or coder, and I need to really help my doc get with the times. You know, I don't know. Is there a scare tactic? Like, what tip have you used to help them help you, but you're really helping them, right?
Well, I've used a couple different ones. It depends on the person you're dealing with. You know,
Mm-hmm.
sometimes I can say, you know, a lot of times I'll show them, well, you might be overcoding over here, but maybe you're undercoding somewhere else. So I can show them
Mm,
ways that, you know, just do what you did, say what you did, and we'll see how it shakes out. You know, so when I'm talking to them about their documentation, I'll kind of show them both. Here you over, here you under. You know, we have to make sure it's just right, you know, or if they're missed services, things like that. If you get the, you know, I've always done it that way for 30 years, kind of, you know, and they don't want to change. When I've taught compliance, I tell people, you know, there's nothing worse. The It's worse to have a compliance program that nobody knows about than to not have a compliance program, you know, because
mm,
then it looks like you're putting it out there for face value just to say, oh, yeah, we're compliant. Look at this program we have, but nobody knows about it. It's not going to do you any good.
mm,
In the program, there should be something in there about QAing and auditing of the providers and the practices. And there also should be something regarding, you know, this is our expected QA percentage for everybody,
mm-hmm,
for the coders, for the physicians, for the APPs. And if they don't meet it, these are the steps that will happen. You know, I mean, I helped one office where we had the physicians were on regular audits. You know, they would get them once a quarter. And if they didn't pass with the rate that was specified, then they would have to get re-audited sooner after getting educated. And then if they still didn't pass it, you know, they would have to get another round of education, and then they would go on a higher percentage to where it would go up to 100% QA, where everything they did had to be looked at, which meant
mm,
that their bills weren't going out as fast, which meant that their RVUs weren't getting collected as fast, which meant that could
mm,
affect their bonus. And then if they still were not being compliant, when they put that person with them at that 100% QA and to work with them, that came out of their percentages. So they had to pay for that. So it got allocated from their budget.
Mm,
So that really got their attention.
there
Nobody
you
wants
go.
somebody sitting in their pocket, and
Exactly.
nobody wants them, doing it when they've got to pay for it. Then they're going to pay attention to you.
Yeah, yeah,
So
yeah.
you can be nice with the carrot. You can also, but you have to have the stick, because there
You
are
do.
going to be some that just don't want to comply.
Wow.
And it makes it hard. But I have one place I was at, and not, saying there was one physician there who just was absolutely sure that what he did was right and what I was telling him was wrong. He used to carry what he called his Betty briefcase. So every time I would see him, he would pull his briefcase out and start pulling things out to like prove to me that I was wrong. He was abusing modifier 59. So he was one of those
Mm,
physicians that believed you could unbundle everything, put a 59 on all of it, and they should pay you for everything. And that was the way to do it. And, we went through all this. And so I was like, I see that, doctor, but, and then I would go back to the resource, because his resources would be some, Uncle Jack's blog off of something that said, you could do this. And, so I'm just saying, you just can't do it. And so he one day came to me and he said, I just want you to know, and I called Medicare. And I said, you what? And he said, I called Medicare to tell them what I did and that I always did it. And you were telling me that I was wrong, and I wanted them to tell you I was right. So he basically turned himself turned himself into Medicare, saying that he always did this and he was been doing it for years, and that I
oh my
was telling
goodness.
him that he had to stop. So
Yeah.
I was like, okay. I said, and then what did they tell you? He said, they told me that they would get back to me, and they wanted my provider, wanted my provider number. So I was like, all right. So then I went to the president and I said, look, I said, doctor just came and told me that this is what he just did. And his eye, like, he understood, because his eyes got really big. He got on the phone. He said, get him in here
Goodness.
now. So he came in and he said, look, I'm telling you, is you will do whatever she tells you, whenever she tells you. And if we start getting audits and things coming in from Medicare because of what you
Yeah.
did, everybody's going to know it was you.
Wow.
Yeah, it was bad.
Talk about the fault of a God moment.
Yep.
Wow. That's
Yep.
crazy. That's crazy. But I want to go back really quick though, because
Yes.
I loved how you said, well, you show them what they've done, but you also show
Yeah.
them how it could be, right? So you're
Yes.
trying to encourage them. You're not just coming down, because one of my rubs with compliance, and I love compliance people like yourself, but there's another side of compliance people that can be very aggressive, very like
Yeah.
not even on education, almost like smacking of a hand kind of thing. I don't know how better else to say it. And it's
Mm-hmm.
like with that approach, even if it's the right information, who's going to listen? Someone might actually not want to listen because of the smacking of the hand rather
Yeah.
than, Bertram, I know you're trying. I know you were not on, let's say, Monday's call, but this has changed and we're here to help you. Is there something I can do? Like just a different approach rather than it's wrong. And, sometimes a
Yeah.
lot of times I feel we can just get within our emotions and when it's not even like that. And I also understand on the physician side too, how much stress they're under. When a physician is usually in an office, they are responsible for every single thing that happens in that office. This will
Yeah.
never happen, but let's say a scalpel falls on a patient's foot. Is that provider's license that's on the line, as well as
Yeah.
all their numbers for the reimbursement? And who wants
Yeah.
to go and tell their boss that this, even if a nurse did it, let's say, no shade at nurses, but I'm just saying, even if it happened like a nurse bumped something, the physician's license is going to be on the line. So
Yeah.
I understand the stress. I understand all of what they have to do. I never knew, let's say if I was a physician, I was going to have to know coding or at least all of
Yeah.
that stuff. So we understand, but it's interesting that they hired you to come in and help them, but they were not accepting of the help. Isn't that what everybody experiences in revenue cycle?
Yes. Yes.
Um,
Well, and it's true too. I always try, because if you go at them with, here's all the things you did wrong, they're going to immediately get defensive.
mhm.
So I usually start out when I'm talking to physicians and APPs about, like, when I've done an audit, I usually talk to them about how great they did at first. That's usually the first thing I say, is that it was really, unless it really, really wasn't, then, I still find something though to say overall, the results were good. You're staying consistent with documenting this and this. Here's where we need to work. And I always tell them it's tweaks. I don't ever, say everything, I'm saying we just need to make a couple tweaks and we'll be
True.
good,
Very
and
true.
then I'll point a couple things out and then I go back to, but here's where it was good. So I
Right.
always make sure I start positive, give whatever
Guidance,
education and
education.
whatever pieces they
Mhm.
need to work on, and then go back to positive. So when they're ending it, it's always like a bravo kind of thing.
There
And I
you go.
find that helps them take that, little bit, like the spoonful of sugar, right? Helps the medicine go down, so it helps if you do that and kind of stick those things in the middle, and then they can take it a lot better. I
Fantastic.
also use their own notes when I am educating. So if I go to a practice and I'm educating on E&M, I will have them send me a bunch of their own notes, and I customize the education so it shows their patients when I'm educating. Because if they're sitting there
Mm.
watching it, and I've heard them before go, oh, that I know that's my patient, then it hits them better. It stays with them better.
Correct.
So for those people that are doing the coding and educating and working with them, make sure you're taking snippets of their notes when you're trying to get a point across to them, and it'll help them because it's a patient that they just saw. So they're like, oh yeah, I remember that. And then you can tell them what your educational piece is on it. So
Yes.
that has helped a lot when I do that.
Yes. 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 Wow. Oh my goodness. I can't believe we're like closely approaching the
I
48 minute
know.
on the hour. And there's so much that I want to talk to you about. What are some of the most common mistakes that you see whenever a practice has reached out to you from an auditing and coding standpoint? Has it been the physicians? Has it been the coders? Has it been the lack of education of their coder? Maybe it was just Sally. I always pick on Sally. I love you, Sally. Maybe it was just Sally that was almost like you, right? You just got the job and they threw you in the room, and all of a sudden, like Sally's coding, and Sally does it for 30 years, but maybe Sally never goes to get any additional education. She doesn't get a credential. They don't encourage Sally to or help her to get that education. They're
Yeah.
almost like, well, Sally's doing it. I run into that a lot whenever trying to book
Yes.
offices. Oh, it's Sally, and it's like, well, what was Sally's background? Like, she's always done
Yeah.
it, and she's not really a
Yeah.
coder. Like, oh, well,
Yep. Or
anyway,
they have books that are 5 years old.
yeah,
They don't buy new coding books because they don't see the purpose to it. I'm like, yeah, yeah, you need those every year. That is
yes.
something you do need.
So, what are the
But
most common things that you see while you're consulting and working with providers or hospitals?
lately, of course, it's been about the evaluation management stuff. Because even though we changed it in 2021 for the office, then 2023 for everything, can't tell you how many times I still look at notes and they're with the 95, 97 guidelines that, they're just still writing the 5-page note for stuff and putting stuff in there that's not necessary. And concentrating on history and exam when it's the medical decision making that's driving everything now. So I get a lot of E&M stuff where, for some reason, although we've seen it everywhere, and you would think you have to be like living under a rock if you don't know that this stuff has changed, but they don't know. I was just at a client that has brought me in to help educate their physicians. Not one of them knew that the guidelines for documentation had changed.
Mm,
And I was like, and they just sat there, stared at me. Their mouths were hanging up. They're like, I can't believe this is going to be so much easier. I'm like, it could have been easier now for a couple of years, you know. So E&M is one, just documentation. It's so hard because from the revenue cycle standpoint, in the billing aspect, if you take commercial patients, the payers can all have different rules. They can all have different requirements for the
true,
same procedure.
true.
Like derm, if you're doing destructions, things like that. Well, one payer may want you to have to put medical necessity in the note, and it might have to be these specific diagnoses, where another payer would want something else. And so it's like keeping up with that stuff that I see practices really struggle with, whatever specialty they happen to be in, is keeping up with all that stuff on that side for the payors. So, I usually say, I help them get things straightened out, whether it be and I'm old school with a lot of things. So whether it's an old school Excel spreadsheet where we start out with listing, what all the payors, different, they don't call them LCDs, but they're coverage policies and things like that, making sure that you have those together. So it can be somehow put in to where my one client has it to where their EHR will kind of put a dinger up. If they put in one of the codes, it kind of puts a pop-up up that states about for that insurance, these are the necessary things, that kind of stuff. So it can prompt them. I'm doing a lot of defense work for audits. And a lot of times it's unjustified by the payors. And a lot of times it's where the physicians and APPs just were poor documenters back then, because they don't ask you for records you just did. Right? They're asking you for stuff that's from 3-4 years ago. And none of that stuff really is usually that pretty, unless they were already on an EHR and it's, tracking everything.
Yes.
So I tell people, it's compliance is a necessary part, especially if you take Medicare or Medicaid. You have to have a compliance program. And again, that's another thing I'm amazed that many practices don't know. They still go back to, oh, well, they said it was voluntary. I'm like, that was a long time ago. If you take Medicare patients or Medicaid patients and you take that money, you have to have a compliance program. But that doesn't mean you need to spend $50,000 to get one. If you're a small practice, go to a small consulting firm, and have them set one up for you. It can be customized down to your size, and the budget should fit your size. I mean, you shouldn't be looking at spending a lot of money on a compliance plan for a practice that's 1 or 2 providers, but you have to have one. And in that, you can answer a lot of these questions that come up about how often are you going to audit? What are you going to do with credit balances? What if all of those kind of things, your steps when records requests come in? What are your policies on evaluation and management? All of those kind of things. You can get, consultants that come in and help you if you don't have the people yourself. And a lot of small practices just don't. They don't have somebody just to sit around for them and tell them what to do for compliance. So when they need somebody, go get somebody. If you break your leg, you don't go to the urologist, you go to the orthopod, so you go to who knows what you need, and let them help you with it. But once that's fixed, you don't go to them forever. You don't go to them every month. You go to them when you need them. So find a consultant that you like, that fits with your practice's philosophy, and, have them on a kind of rotating. A lot of my clients, I have them on like a subscription kind of thing, where we have so many hours a month, or I'll come on site so many days a quarter, and it's budgeted out to where they make a same payment over the whole year. So it's not like all of a sudden at once you got some giant payment from a consultant that's due. You can make it manageable to where you can be compliant and stay within all of the crazy regulations that are going on. So you keep the money you deserve, but it doesn't break your bank.
Exactly. And hopefully the revenue with increased documentation and better coding will go up. So let's just say the revenue has gone up a little bit, but also their spend or their investment in that didn't go up astronomical, like all at once. So all depends on the client that you're dealing with. And I really appreciate you being on the roundup. Let's go to the comments really quick.
Yeah.
Not all of them have come in, as I mentioned, with this platform.
Yes.
But yeah, so we have Victoria chimed in, and she said, when we're talking about the price of everything, she said that everything is going up and more expensive in price, except for physician reimbursement. Yes, they can still afford their Porsches and stuff, but other things maybe not so much. Stacy chimed in, and she said that she can relate to you just working with physicians and how you may just have that real stubborn one that just will not change, And
Hey, Stacy.
we all thought that it was hilarious. Arefka says hi. She's late, but she's excited to be here from North Carolina.
Good.
Stacy had a really good tip for all of us. She said, as a physician, your coding consultant should be your best friend, the one that tells you what you need to hear, not what you want to hear, you know?
Yes,
And
yes.
isn't that what doctors do all the time? You know, it's not about
That's
like,
very
hey,
true.
you can continue walking on that broken hip and just take some pain meds and you'll be fine. It's like, no, you may need a replacement because long periods of taking this medicine could result in this. So maybe we can help them swallow the pills of compliance and coding and being up to snuff. And I love how you said that with them working with you, it doesn't necessarily have to be just like all at once, right?
Huh,
Or they may have heard sticker shock from a friend that works with a
right.
big 13, 14, 15 provider office. I'm like, yeah, we just paid this coding consultant company $100,000 when
Yeah.
they're, let's say, coming up with a compliance plan, very simple coding in regards to their specialties, or that maybe they're very specialized. And
Yeah.
Stacy, I do want to connect with you because I think that you'd be great for the roundup going on the other side
Yes,
about
she would be.
focusing on specialties and how that could benefit somebody's career and working with. So we'll connect. I'm definitely going to do that. But going back, maybe that person only needs a $5,000 program, but at
Yeah.
least having that in place. And then one thing that I was going to share, I think was also very helpful whenever you're trying to educate, let's say, that stubborn provider, is by
Mhm.
catching everybody new that has come in and helping them
Yes.
know that this is what the standard is.
Yes.
So 30 years later, hopefully with that same practice or hospital, they're following the guidelines or they're more open to changing whenever those guidelines change. So I
Yeah.
also think in, yes, we can focus on, the issues, right, at hand, but also focus on anybody new, because then that's just going to make your job a whole lot easier. And
Yeah.
then maybe they can even speak to those providers as to, well, I'm doing it, and like it's okay, like it's not that big of a deal. But
Yeah.
the whole thing is that we're all here to protect each other. We're all here to protect the
Yes.
physicians. We're all here to protect our employers. We don't want to have this big audit and then everything go on, because we know how the government is. The government's not just going to say, oh, I want to see what happened in the last 6 months. They're going to go back, and they're going to go back years, and they're going to be like,
And
whoa,
they're going to
well,
come back in another 6 months to make sure
yeah,
you're doing
exactly.
it.
So we just have to be very careful with that. We're here to help them.
Yeah.
We do have a question in the
Yes.
comments. So this person said that they agree with you, Betty, but there's so much resistance to changing to the new standards. So why is there so much resistance to changing to the new standards of E&M?
I really think it's because when they put them out there, at least in my opinion, everybody was just like, "Oh, this is going to be really easy. We're just going to do MDM or time," and there really wasn't a lot of education that was taken for it, and
Mm,
so they thought it was not going to be that big of a deal. And once you like, I have a workshop that I do on E&M, and when people start doing it, and we say, but what about this? And what about this piece? And you can ask these questions. It's a lot more complex than it seems. And I think
mm,
it's just the status quo. They've been doing that since 1995. They don't like change. Everybody's a creature of habit. A lot of the EHRs are still set up in the 95 and 97 guidelines for their templates. So if they use the EHR and that's how it pops up, they just continue to do it. So I think it's not so much that they're resistant to changing. I just think that the especially on the digital side of it, the electronic health records and things like that, they really didn't update all of them like they should have, or maybe
mm.
the practice didn't want to pay to have the upgrade or change or whatever it was. So the old stuff still shows up, and so they just keep using it. So I still see, the complete HPI with the location and the quality and and I'm like, this is just so not necessary. Or the exam, and they'll tell me they do a 12-point review of systems for a patient that's there for a cold, or, I'm like, really, just stop. You just don't have to anymore.
So are we
So
not on 95, 97 guidelines anymore?
no, I know. I'm just like, no, no,
Wow.
that kind of has changed. And when you show them how much, sorry, I got to plug my computer in before my battery goes dead.
No
When you
problem.
show them how much simpler it is for them now, usually all it takes is this once, and then they're all over it. They're like, oh my
Yeah,
gosh, so much better. But
exactly.
there's usually at some places, there may be one coder to like a dozen physicians sometimes and APPs. And so to get that to all of them, it takes a bit, and
Mhm.
sometimes, it just
Yeah.
takes a while to round through everything. But
Yes.
that is like the number one. I'd be having, gathered meetings about this and saying, hey, this could be so much easier for you. Let's show you this and show them notes side by side. Here's what
Yes.
you used to have to do. Here's what you can do now. Look how much easier it is. You're saying the same thing without all that garbage that you had to put in there before
Yes.
just to justify your level. So
Yes.
I think it's just showing them, and showing them once, they will think you're the bomb.
There you
I
go.
mean,
And
they will
that
love
it's
you.
so funny because I remember the 95 and 97 guidelines because there was a question on our prompter when we were talking to candidates and people with backgrounds as to what they may have. So like I even 95, 97 just comes to mind so easily, so quick.
Yep.
And you're saying that we're not on there anymore, right? So
Nope.
that is just crazy. And we feel the pain of anyone that is, let's say, the coder of the office, because they may not turn to Betty. You should turn to Betty and anyone that's a compliance expert in our space, because they can help you. Because imagine you're that coder and then you have to try to be the one to enforce or let them know about the new compliance changes. So we do also feel with those lone rangers, or maybe even those people that may not be
Yeah.
credentialed, but maybe that's something that you should talk to your office manager about. Or if you're the office manager, talk to the physician. Like, hey, like this is a big deal. This is going to help us. We need to be compliant. They're going to help me figure out what we need to do and all of that stuff. And the investment is so minimal. I mean, imagine spending a few $100s a year to make sure that revenue is clean as a whistle. So,
Yeah.
and all the other discounts and stuff. Betty, we can go on and on and on and on, but we're not
But you
going to
have a
do that
lot of
today.
good stuff to get to with the people, though. I know that the next portion of what you do on the roundup is really, really important. And
Yes.
like I said, I just love the idea that when you had it, and I 100% support y'all in what
There
you're
it goes.
doing with
Number
it.
three. Y'all number three.
So,
I gotcha.
so yes, you do a great service for people that are listening and looking for stuff. So definitely get to helping everybody else that's looking and get them all connected. And
Yes.
anytime you want me back, I'm happy to come back. And for
I know
those of
for
y'all that
sure
are on here, come
we're
over
gonna
and
bring you
follow
back.
me on LinkedIn and
Yes.
watch my healthcare happenings and with Bertram and yeah, you just do wonderful things. So thank you for doing this, Bertram.
Thank you, thank you. And we are for sure gonna have you back next year because I don't know, this just keeps on getting better. And I think as things change, we're gonna want to know the latest and greatest from folks like yourself. So, maybe we did not pay for a consult, whether it be recruiting, staffing, or compliance, but tuning into these people and they're providing so much content. I mean, it is invaluable. I mean, you even talked about strategies as to if your physicians are having a hard time changing, how you can do it. And I mean, you gave so many great examples and strategies. So this was fantastic and great. Betty, stay warm. Thank you so much for being a guest on the Roundup, and we will see you next year. Happy holidays.
Yes,
Okay.
thanks, y'all. Merry Christmas.
All right. Have a good one. Bye bye.
Bye.
Wow. Love to have Betty on. And I'm telling you, within the staffing world and helping providers across the country with their coding and with their staffing, maybe even just some recruiting, finding them a person, you wouldn't imagine how many times we run into that same situation that I talked about a little bit earlier. They have Sally, she's doing the best that she can, but she has an outdated coding book. She's not credentialed, and she is drowning actually because she has so much work that she has to do. Maybe it's not only coding that she's doing, maybe she's also doing the billing. And how somebody like Sally can talk to their providers, talk to the office managers, try to get credential, maybe even have them reimbursed for it. There are a lot of workshops and companies that do workshops, including Betty, that can help you with that. And for them to get their credentials, for them to be compliant, for them to actually say, hey, we need to have this and let's get this person. It's only going to be an investment. I really hope folks will start looking at a lot of things when it comes to compliance as costs or what it costs this place or this place. There'll always be places that are going to spend ridiculous amounts of money. I was in a conference. This client started talking about how much they spent on a 4-month project. My mouth dropped. I'm like, whoa, that is crazy. Oh, well, it was just short term. It was short term. I'm like, that's still a lot of money when they probably could have had 4 or so other bids for half the price. So don't let the sticker shock, scare you away. Reach out to folks like Betty that can help you. Okay. Wow. Okay. So let's continue with the roundup. So for jobs and opportunities, I don't have any new external from places that I've known or things that I've seen on LinkedIn. What I did want to share, if you have 3+ years of hands-on experience as well as your full credential from a HEMA or the AAPC, I know within Renown Talent, we are going to be looking for inpatient coders, outpatient same-day surgery coders on the facility or hospital coding side, as well as ED coders on the hospital facility coding side. For Profi, we've had some positions. I think we had 3 to 5 positions as of recent. Those are probably going to be closed by the end of this week. But we are only growing, expanding, and more clients are seeking our services. I have proposals put together for so many clients. It's getting very busy, but I do not want to not have these roundups. So I will sacrifice whatever I have to. Maybe the family may not like that for a little bit, but I just believe that instead of us sacrificing things that are important, not just to us, but others within our industry, that we just have to try our best to make it work. So I love and appreciate all of you. If you happen to have some of those backgrounds that I talked about, stay tuned, connect with me. You may have just attended the roundup today because of Betty, and that's fantastic. But let us get connected. Send me a connection request. Whenever I have new jobs and opportunities, I will either post them, or on Mondays, I am trying to do a live stream where I do a career report and I let you know exactly what's going on in terms of the opportunities, the openings, and I share more. I go more in depth about exactly what the jobs are and tell you a little bit about the client. Of course, I can't divulge that information. The client doesn't want their business out like that. If they did, they would put it out themselves. But I can help you understand, for example, if it's working for like an AI company, with a computer assisted coding, and you actually helping the machine learn and help the machine with those corrections as well. So we all know that the future of coding is probably going to be more from an auditing standpoint and working with AI, but that is going to go back to documentation. So interesting. The question that we have this week is all about documentation on the Ask Mr. B section, okay? But we're going to have future opportunities for facility side coding in the near future, inpatient, outpatient, same-day surgery, as well as ED. And if you're really anxious and ready to get started, I'd love for you to get tested over the holiday season. So come January, you pass your test and you can just move forward. So let us connect on that standpoint if we can, okay? The vendor spotlight, I've been sponsoring, well, not sponsoring, I've been highlighting them for a little while because we get no kickback from this. But there is a company called The Qualified, and what they specialize in is helping people get qualified in their credentials. They also help out a lot with CEU education. So if you're behind in your CEUs, let's say you want to do a workshop to get your CCS, that's what I said, CCS within a weekend, they do things like that. RHIT, RHIA, they're even involved on a lot of the HIMSS credentials as well. They help you study so you don't have to, for example, try to take the test by yourself, fail, reach out to them, pay them, and then take the test again. It might have been easier the first time to make sure that you knew what you were supposed to know. They would have helped you out with that, and then you could take the test and pass on the first go. So for those that are able to pass the test first goes without any help, great and fantastic. I myself, I may need a little bit of help, or I like to double check myself and make sure I know what I know. So places like The Qualified are fantastic. They also will offer you a 10% discount just for mentioning the roundup. So feel free to mention us. As I disclosed, there's no kickback for us, no financial benefit for us, but this is more of a process and something that a service that you can use. Okay. Fantastic. So for this week on the Ask Mr. B section, so this person watched our video with Misty last week, entry-level coder. She loved it. Great video, caught her attention. She went to school for HIM in 2003, wanted to become a coder, but she was also recruited right after school for an EMR implementation. She's done that wonderful career in implementations, but she also has an LPN background from her healthcare career. So she misses nursing, but she realized she wants to get back into nursing, but also maybe probably utilize some of her medical coding education, right? So she's asking about CDI. Would that be a great career path for somebody like her? Also being eligible for RHIA, LPN credentials to start in CDI. So she's also wondering about the combination. Usually they'll like for you to have, let's say, a CCS and a CDIP, or maybe you have your RHIA and then you get credentialed directly through Actis, having your CCDS. Okay, so this is more about clinical documentation improvement. We call this CDI, clinical documentation improvement. Now, one of the interesting things that maybe Betty and I did not cover in detail was CDI is clinical documentation improvement, and what these individuals do, if you do not know, they're usually hired by a facility to help their providers improve their documentation. So this may be from somebody from a coding background, right? That went through, let's say, HEMA's CDIP program, or somebody went through ACTIS and maybe they were a nurse. So sometimes it'll be an RN. The RN is somewhat LPN is great for this because they have so much clinical experience that they can usually talk to the physicians in their language. They kind of like have been in that environment. I'm not saying they're the only people. There's sometimes coders or HIM professionals that work within that very same environment so they can speak to the physicians as well. And that's why they are also highly considered for those types of opportunities. CDI is a very big thing is because we need to try our best to get these providers to help us, right? And it's all what Betty and I were talking about for over like 40 minutes, getting them to change because so much has changed, and scheduling meetings and just trying to have special workshops and stuff. And whether, I don't know, that physician is always traveling. So I don't know, doing Zooms with them and trying to help them figure out exactly what they need to do. That's what CDI is all about. So clinical documentation improvement is a big one. Will you be able to get there just with the LPN? I don't know. I think it's going to come down to a lot of factors and what that facility needs. Maybe if you're able to be more on site, that's something that they can consider. But I would say if you're interested in it, and if you have some experience with it, maybe you even may have some examples to interview and show that, hey, I've helped physicians improve their documentation. I would encourage you to apply. Because right now, there's not necessarily a firm you need to have an RN and a CD, that's ACTIS credential. I know it is preferred, but a lot of employers are looking at the person as a whole. So, thank you for the question. That's a great question. Maybe some people didn't even think about like, hey, there's a job. I can be a, clinical documentation improvement specialist, CDIS. Yeah, you can do that. That's something that you can do. Okay. Betty's in the chat and she's in the comments. She says CDI is growing on the outpatient side. Coding and nursing backgrounds are fantastic for this area. So if this is something that you have not considered, maybe that's something that you can possibly do. Okay, working more with physicians. And it's all about you maybe having some of that experience in a coding or nursing perspective, and then bringing that to the physicians, helping them with their documentation. Okay. All right. I'm going to go to the comments really quick. So we have Refka that shouted out to Betty. She says, y'all all the time. I love it. It shows your personality, shows who you are. This is great. Refka also said, thank you for doing this. We appreciate you. Refka, I'm watching you. I'm following you. Amazing things are going to happen very soon. Keep us posted, okay? Betty also mentioned that we're doing a great service here for the people in the industry trying to find the right fit. So she appreciates us and we appreciate you, Betty. So thank you for being a guest again. And I think now it's time for us to go to the talent showcase. So we just had one person, I believe, and I'm going to double check the comments in the live version that's shooting right now. But I only saw one person filled out their information, and that was Stacy. So she's in Colorado, 3 years of urgent care coding, fully remote setting, and average around 18 charts per hour. So if this is somebody that you can possibly use, definitely feel free to reach out to her and possibly offer her a job and opportunity. I actually connected with Stacy as of recent for the Profi opportunities that we had. Wasn't a fit, but that's what it's all about. It's all about sharing. It's all about knowing people, reaching out to them when you have those types of opportunities. Okay. So the next roundup is scheduled on January 10th. We are actually going to have someone from the Qualified on the show. So the Qualified is a small business out here in Florida, and they're all about helping people become more qualified, get their credentials, and CU education. And I thought it would be great for them to speak with us about how people can actually go about doing that. So we're going to start January 10th, not that very first week in January, the second full week in January, and really appreciate you. So for something that we have only done for, I don't know, not even 2 months, maybe 2.5, maybe close to 3 months with the holidays in there, I'd say like, wow, I'm really surprised by the feedback that we've had. It's interesting. A lot of people, like I post stuff all the time, jobs, opportunities, whatever's going on, and I would not get a lot of feedback, right? But something about the roundup, a lot of people are telling me, Bertrand, I saw the roundup, I saw you on the roundup, and all of those things. Like, I don't know, it's interesting. I almost feel like at some point it's somewhat viral as to look at this guy talk to different people and have great guests. Like, I didn't know Bertram's Rolodex was this wealth of people. And I almost asked myself, well, what have I been doing as a recruiter for all of these years? But once you realize that it truly comes down to relationships and talking and working with people, and maybe it's not only about you and what you need, maybe it's about helping others. Once you figure out that piece, that's where I think a lot of our problems will be solved. Somebody got at me last week, so they saw the video that we did with Misty, and Misty, if got hired based upon networking. She was talking to this individual, and anyone could have talked to this individual, but this person took a liking to Misty and had her interview. She was selected and hired for the job. Some may view that as I forget what the I forget what the term is. Is it fraternization? Like special treatment towards people that are like similar to you or like you. But I think we've all do that, and we all have had that experience. There have been places early in my career when I was in college and I was just trying to get a job, so this is nothing serious. I don't work at Starbucks, retail store, whatever, right? And I actually ran into people that I happen to know, and they're like, wow, I think you'd be great for our company. I'm like, okay, cool. And you interview and they hire you and you start working, right? Doesn't mean that you blocked out other people or they wanted to give other people the job and opportunity. No, but if they took a liking to you, why not? If you just happened to know that person in a previous past or had a previous experience with that person. I don't want to turn this into something that's bigger than it really is, but I just think that we all have to realize that we all have to have something that speaks to people. And whether you have experience or you don't have experience, we all look for that advantage, right? What is a blessing at the end of the day? A blessing is a favor. And if you can't get favor, and we all done it. Like, I've interviewed for places that I heard that they had dogs. Excuse me. I heard they had dogs, so I brought in dog treats in my interview. Why? Because I was a struggling college student and I didn't want to be unemployed forever, right? We've all done it, but I think some people can just take it way too far rather than at least, like for me, I appreciate that an entry level coder was able to get hired because I know how hard it is. And a lot of people look at our industry within revenue cycle, health information management, and think it's only coding that it takes like forever and a day to get hired. It took me over 3 years to get hired as an entry level recruiter. That's a job that nobody wants. I didn't have to get a credential for it, but who wants to be a recruiter? Nobody, right? And it took me 3 years. There are nurses or people that went to nursing school, graduated, took the state board, have their nursing license, and they had to wait 6 months to get the job at the local hospital. It happens. And you may say, well, Bertram, don't we have a national nursing shortage? We do. It still took that person 6 months, right? I have some of these testimonials. But you know what? I just say, don't hate the player, just hate the game. Or become a better player at the game, I should say. Just increase your network. Start giving, start volunteering. There have been people that have volunteered at chapter meetings, and because they volunteered, they got some more exposure, and people got to know them a little bit better and offer them jobs and opportunities. We're all trying to get there, right? So just be a part of it. Just participate. I would dear for all of us to think a little bit different within 2024 and start giving from the start and see how things change within your life professionally and personally. So I'm going to do a last little scroll through in the comments. So Betty is sharing with us that that networking is gold. You can never do enough of it. One of the main reasons why I started the roundup is to give us a better time to network and for us to share more about what's going on in the industry. Betty, I appreciate Stacy for joining. And Betty also said that she totally agrees with Stacy. She's been talking to clients that said yes or to consultants. But it may not have worked out for them. So yeah, it's all good. So hey, we're gonna see you on January 10th. I may not do a live stream on Monday, just because it's a holiday season and things are slowly winding down. But we ended this year on a high note, and I know we're just starting the new year with a whole lot of momentum. So I wish you and yours the best for the holiday season, and we'll see you next time. It's Bertram. Talk to you later. Bye bye.